my first question to you today is, how is Pediatrics Residency? I mean, can you give us an overview or an introduction in brief?
Okay. First of all, thank you, White Army, for choosing the topic. It's a need of our hour. So pediatrics, if students have already made their choice to take up pediatrics as their career option, then it's a great decision. It is a very happy branch. It is a very, what you can say, a very objective branch. And it has all the positive aspects in terms of economic stability or academics or the work culture, work ethics, everything. So pediatrics is a very good branch, I want to say. Pediatric residency, like other residencies, it's also like a hectic one, not a very cool one, but manageable. And it's a medicinal branch, so the load of learning, surgical aspect, those things are not there. So a lot of time for academics, lot of time for ward work, that is there. And most of the places, it is not a cool branch. It is the resident have to be on his or her toes to work in the pediatric wards, but it's a happy branch. You will see happy faces and happy parents everywhere. Even though they have come for their illnesses, you will go home very overwhelmed or very satisfied. So that is there. And as a branch, pediatrics is very straightforward. Like if pain is there, child will cry. If pain is not there, child is happy. So it's as straight as that. So it is easier to learn. In contrast, like many people will think that children will not be able to express themselves. It's a difficult thing, etc., etc. It's not so. It's very straightforward branch, and all the signs, symptoms, the treatment, everything is like objective. So it's quite interesting as a whole.
So on a whole, in like 2 words, it's hectic, but at the same time, it's very satisfying.
Yes, correct.
Ma'am, and for all the aspirants who want to choose pediatrics, how do they choose colleges? As in the criteria as in would be like a government college versus a private college, or whether they choose colleges in the cities or peripheries, or central and state institutes.
Okay, so while choosing a college, I would like to give a checklist, like what all things you should see. First thing is like the non-financial ones, like what is the patient load, what is the academic at that institute, who like consultant, how are they, that the mentorship program is going well or not, that thing you have to think. And the second part is the financial part, where what is the fees of the college, what is the bond, what they offer for to break the bond, how much is the money, and what is your feasibility, like you want to stay close to home or you are okay to go everywhere. That is one thing. And the most important other thing, which is least talked about, is how is the workload there. Like, is it like you are going to stay in hospital itself, or you will get time for yourself, or for your nature, are you going to manage that much of workload? That also has to be considered. So coming to each point, I will briefly tell, then what are the questions you ask, no, you can tick the box accordingly, and
yes,
it's easier for choosing. So workload, patient load, there should be a decent workload. It is not like the ward should be full and you will have so much of work, then you will be a good pediatrician. It's not like that. You should have a good exposure in all the terms. So that is the good patient load definition. Like you need not have 50-100 admissions per day, but you should have variety of cases, everything. So in terms of patient load, the major cities, most of them will be a referral center. So you will see all the spectrum of cases. So it's more useful. The peripheries also, it's good. It's not a bad choice to make if you don't have other options. But if you want me to choose one, then the major cities, in terms of the spectrum of cases, what they offer, it's better to choose the colleges in major cities. The government and the private colleges, see, this patient load, the mentorship, academics, that you have to consider, because some of the private colleges are much better than the government colleges. Some of the DNB colleges are much better than the government and private colleges. So if you see all that, which one offers the best, so you should choose that according to me. And the mentorship program, so that's much more important, because if you have the patient and you don't have anybody to teach you like how to go about, then that's a waste of the resources. So when you ask your seniors or the seniors in the other colleges, you should ask that also, like how is the mentorship, is there any people to guide us and everything. And workload, so you should choose a decent workload. There are many colleges, the names are like very famous, but students will go and suffer there, like for good 12 to 16 months they will not be able to touch their books. It's not the ideal workload what you expect. Like if you don't have a choice, it's a different thing, but if you have a choice, then you should put all these things as your priority, and then the rest of the things. And I think the financial part we need not discuss. It is up to their personal choices. But the one more thing what I should say is, like, my seniors once told me that if you have a good rank, there is no point going and suffering somewhere. uh, Apart from that, you can choose a college which is nearby to your house and offers a good decent workload, decent clinical spectrum of cases. Then better to choose that. Like, the choice should be individualized and seeing all the checklist options, because soon after you get a rank, there is a tendency, okay, these are the major colleges, India Today rank 1, 2, 3 colleges, they will just go and jump and take that, but you should choose. And the one more minor, it may look minor, but it is important. You should see the safety of that college. Like if you are working as a resident, like how safe it is, and stay, do you get a decent stay over there or not, that also should be considered and given as importance as you give for other aspects also.
So to summarize it, it is important to put into factors like, consider factors like the mentorship, the patient exposure, as much as importance is given to load, and as well as the workload which is there, and also the safety aspect of it.
Yes, yes, true.
Yes, ma'am. And the financial aspect to be individualized, from person to.
Yes.
Okay. Ma'am, then what is your opinion on DNB? If you were given a choice between DNB versus MD Pediatrics, how would you go about it?
See, as I told you earlier, there are many institutions, DNB institution, who offer much more clinical spectrum of cases, and the training wise, they will be very good compared to other medical MD courses. Even the NMC says that DNB equal to MD, but still when you go and apply for your job, they will see you are a MD or a DNB person. That is still there. That's on paper that it's both are equalized, but it's still there. So by choosing, if you have an idea that what kind of practice you're going to do in the future, like if you're going to join a medical college or academic institutions, then better to choose a MD. If not, you're going to do a private practice if you're sure, or a super specialty if you're very sure of, then MD, DMB doesn't matter. The training matters.
Okay. Okay, ma'am. I'm moving on to the next question regarding the 3 hectic years of residency. What is your advice on how the residents need to strategize, plan, prepare, and how are they going to handle stress during this period?
Okay, it's a very important question. Like most of the colleges in India, 3 years of residency, the first year will be very hectic, first year, second year. Third year will be lighter in terms of work, but more of academics and studies. So if you want to divide the strategy into the normal ward work, the academics, thesis, and stress management, we'll talk in these 4 headings. Regarding work, most of the places, first years are given like just better job than an intern, like doing all the procedures, collecting reports, seeing some patients, all those things. But if a resident is smarter, then he can learn many things. So for a first year, they have to get well versed in procedures like LP, bone marrow, pleural tap, ascitic fluid taps, all those things. And most of the times what is the tendency is like, my senior does that, so I am also going to do that. So that should not be your approach. So whenever you do a procedure and everything, so you see what is the recommended thing and try and implement the same whenever you do that. That way you will learn more. The second thing is the ward work, whenever you are collecting reports or small things, everything, try to interpret. You may be wrong at times, but try to interpret. Don't consider yourself as a junior. You're junior for work, but you are there to learn. So first year has to be very careful. And academics wise, so it's not like you're a first year, you need not study. It shouldn't be like that. All 3 years you should be academically oriented. So first year, because of the hectic work schedules, you'll not be able to open the book, but try and involve in as many academic sessions as possible, like small seminars or case discussions or whatever it is, so that for that reason, at least you'll open your book and read something. So if you really have to, it's better to start reading from first year itself and cover the basic topics. Like for a pediatrics, basic topics are immunization, development, nutrition, all those things. So those things has to be studied in first year itself, because for a third year PG, oh, these are all very silly things they think, but these are the basic things. If you read in first year, then your basics will be stronger. And thesis work, usually thesis, many of the students may not have got their exposure during their MBBS time, so they feel it is very alien or a very difficult task. But it's okay to feel like that, because it is the same for everybody. So those who have done in their MBBS, then it will be easier. So my advice would be, try and attend any research methodology workshop and everything if it is available, so that at least what your mentor is telling, you will be able to comprehend and do accordingly. So slowly you can do. So if there is any workshop available, then it is better to do that and ask questions. It's okay not to know thesis work if you have not done it before. If it's new, it's okay. You ask your seniors or your mentors and try and do as much as possible. That is for the first year. Second year study, second year is, I think it's the best place. You have got adjusted to the place, and you know a bit of you have a hang of your subject. So it's a very good year. So second year you will have ample amount of time to do your thesis work also. That has to be done with all sincerity and everything. So regarding ward work, so you try and think as a consultant, like for MBBS level, you have to just present history and examination. But for a PG level, you have to have a approach, differential diagnosis, what is to be done and everything. So if you're seeing patients on daily basis, before the senior comes or the consultant walks in, try to have your own plan, so that your brain will be taught, trained to think as a consultant. After 1 year, when you finish, your brain will be already trained. So that has to happen consciously, like make a plan before the senior walks in. Try and make a plan, may be right or may be wrong. So try and make a plan and implement it. And the academics wise, the second year is the best time to study case wise. Like if you see a rare case or a non this thing case, so try and go and study according to the case and try pull out articles, try pull out the recommendations and study, make notes and keep that. It will really help. So the interesting cases and everything should be read properly in second year. In third year, usually the thesis will be there. So try and finish your thesis before your exams. Don't keep it till the end. So before your exams. And again, by third year, you will have an idea like what is to be done for the thesis. And try and ask more and more questions, like what is to be done and everything. Don't waste your time reading everything on your own and doing. So take help of your mentorship. That's okay, because first time writing a thesis will be really difficult. It will be difficult for everybody unless you have done it before. So it's okay to feel bad and ask questions and get the help. The academics wise, try more and more academics, case presentations, bedsides and everything has to be done, because it is important for the exams. And try and attend more and more OPDs, because after 1 year you're on your own and you have to see patients on your own. So seeing a patient in ward, it's different. Seeing a patient in emergency is different. Seeing a patient in OPD is different. So try and attend more and more OPDs, make all own plans and communicate to patients. Like you should be confident in talking to patients after 1 year. I mean, just after one night of after your results, you will be pediatrician and patient. You have to treat patients on your own. So that is the case. So try and communicate to patients so that you will have that confidence. And ward work wise, so again, more approach, supervise your juniors work. That will teach you more and more things. And and treat patients as your own, like you are only treating the patients, like that attitude should come when you're a senior PG. And academics wise, it's third year is the time to read systemically and textbook wise, chapter 1, chapter 2, chapter 3, because you have to give exams after end of the year. So start reading, and if whatever you have done notes and everything in the previous years, that will also have to be consolidated and start reading. And the best method is to revise, is to teach your juniors, the first year, second years, try and teach small topics, or tell your juniors to read some topics and teach you and discuss. So discussion and teaching others it's much more helpful than reading a textbook in a library. So that has to be followed up. And regarding stress management, I want to make few notes, like yes, there will be stress of duties, stress of academics, managing academics and everything. So first thing is, like, if you are stressed, it's okay to feel stressed. Everybody are human beings, that you should admit. And try and maintain a good relationship with your colleagues and seniors. Don't spoil relationship for one extra night duties, because those are the people you're going to interact with on daily basis. That has to be done. And for a short period, if you can maintain your own hobbies, that is going to help a lot, because when you hang out with your own department friends, you will be bitching about the same department, same workforce, all those things. That will be a vicious cycle. So at least 10-15 minutes of reading a book or painting, whatever you are good at it, whatever gives you pleasure, that has to be followed, that has to be done on daily basis, or at least weekly basis. And during the day-to-day work also, try and take short breaks. Like if your work goes till 8 o'clock or 9 o'clock, try and take a short break at 5:30, 6 o'clock, go for a coffee, freshen up your mind and come back and work. That will on quick basis will activate you more. And have good food. Don't become a soldier or this thing that leaving the food, the sleep, everything, I'm going to save the patient. That attitude won't work in longer way. So prioritize your health, prioritize your food, try and have food on time and then work. At least take a short break for 10 minutes, go quickly have lunch and come back and then proceed. So for long run, if your physical health is maintained, then your mental health also be good.
That gave a lot of clarity to the whole, very difficult topic to address, ma'am. Thank you. Ma'am, my next question is, like, how to train oneself into a successful pediatrician?
Okay, so most of the things I think we have already talked about. The special mention is like 3 years of residency is not everything. It is just a license to learn and practice pediatrics for rest of your life. So it's just a license to learn more and more. So my advice would be to do pediatric residency for 3 years and do senior residency or work in a good institute where there is exposure and there is more and more mentorship for 1 or 2 years before moving to your own practice or doing the super specialty. Because residency, you are under the umbrella of somebody. So some part of your brain will be thinking, okay, if I do something wrong, somebody is there to cover me up. But when you are a consultant or a senior resident, then that covering will not be there. Then your brain will work more. And try to enjoy the work so that your brain will be fresh and you will be able to deliver the service properly. And it's not like 3 years you have read it and you need not read more. You have to update yourself on daily basis so that your efficiency will be more. So that's the thing. And don't run behind super specialty, like that has to be done, something like that. General pediatrics is a good branch, so that's it.
Since you mentioned about super specialty, like what is the way ahead, ma'am, after pediatrics? Like what are the different options which are there in terms of either practicing or options for super specialty or fellowships?
Okay, so this is an important question. So before thinking about super specialty and fellowships, so one has to be there are two requirements. One is you would have done a residency from a good college, good patient exposure, and 1 or 2 years of pediatrics. If it is more, then it's even good. SRship from a good institute, so that your pediatric base is strong. The second thing what you need to know is where you are going to settle and what is your career options. Like if you're going to settle in a metropolitan city or a second tier city, or you're going back to your taluka place or a district place where you're going to practice, that has to be decided first, because your super specialty fellowships options will change accordingly. Currently pediatric super specialty, even the practice wise, it's not established across all super specialty, like unlike adult super specialties. And even the courses, the limited number of seats are there. So pediatrics, the super specialty courses offered are, one is NICU, PICU, pediatric ICUs, and pediatric oncology and hematology, and pediatric gastroenterology and pediatric nephrology. These 5 areas you have DM seats. Very few numbers, single digit numbers are there all over across India. And hematooncology, nephrology, gastroenterology, you have FMB seats also, fellowship in national board. ICOs, you have all kinds of fellowship like university fellowship, institution fellowship, NNF, and IFE fellowships. Everything is available. So my advice would be like you decide first where you're going to work, what your career options are, and then choose accordingly. Because some of the specialties like nephrology, gastro, and hematooncology, for that matter, they are not very much established in second tier cities. It's not like it's going to be flourished in another 5 years or 10 years. You should have a good referral unit or a center or a multi-speciality unit to practice all these things. So after doing a super specialty, if you go and practice in a second tier cities, it may be difficult for you. So you choose your options wisely. And ICU fellowships and TM options, both are good, because even the smaller cities and the peripheries need ICU facilities. You cannot refer each and every patient. So in that case, these two options are also useful.
And ma'am, my last question for today is, so surgical branches, usually they say is male dominated, but when it comes to pediatrics, what is the scenario? And what are the challenges or difficulties that a woman taking up pediatrics would encounter?
Okay, so this question might be tricky. Non-feminist audience may have a problem with these questions, but I'll take it more objectively. That as you told, like surgical branches and other things are male dominating. Pediatrics it's a mixed branch. There are very good female pediatrician, very good male pediatrician, and wherever you go, you will see the mixed population everywhere. And regarding patient choosing a pediatrician, so it doesn't really matter, because the good male pediatricians are also having good practices, and academically they are excellent. So it doesn't matter if you're a male or female, you are taking up pediatrics. It's as good as doing other medical fields. And I don't see any great challenge in women taking up pediatrics, because it's a medicine branch. So and you have a career option, like if you want to just sit and do OPD, that is also possible. If you want to go and practice in medical college, that's also possible. If you want to become a super specialist, that's also possible. So it's a wide spectrum of options are available in pediatrics. So specifically, I don't see any challenges for women in pediatrics. And one of my teacher used to say always, like before taking up pediatrics, you should be a parent first. Like being empathetic, able to understand parents' anxiety and their problems, and responding to them, that quality will make a difference rather than male or female.
Oh, okay. Right. And ma'am, we'll just see if there are any questions on YouTube. I'll just go through it. There's one question on diploma in pediatrics.
Okay, so there are some TCH courses available, but as for my knowledge, they are TCH courses are the universities are they are converting it to MD options. So if you have already done a diploma, then if you're going for a medical college practice or a teaching hospital practice, then the course is not as recognized as MD or DNB. You have to do the secondary DNBs, secondary DMC, DNB, or a secondary MD. So if you have an option of MD or DNB, then that would be better than diploma options. But as for my knowledge, many of the diploma courses are already getting converted into MD.
That's it, ma'am. So thank you very much, ma'am. I mean, you've given like so much clarity into this whole field and you've explained it so elaborately. So thank you very much, ma'am, for coming on to our session and spending your valuable time with us.
Thank you, Priya. It was very nice interacting with you also.